classroom. Screening for dyslexia is imperative, and most states now, all but the 8 I mentioned, are referred to, not by name, are including guidelines for dyslexia screening. And what do those screenings involve? They involve timed tests of letter naming or letter sound associations, direct measurement of phoneme awareness that gets at phoneme segmentation and blending in kindergarten. And then as students get older, if they're having problems from 2nd grade on, I personally see evidence in the work of David Kilpatrick and others that we need to screen for advanced phonological awareness, advanced phonemic awareness skills in older students, because those skills underlie the acquisition of a sight vocabulary and the acquisition of spelling vocabulary as time goes on. And then we need to directly measure decoding and word recognition and oral reading fluency using a time test of passage reading with norms, that is a grade level passage that is equated to a certain level of difficulty in curriculum-based measurement. And we need to measure both rate and accuracy once a student can read. The social and emotional consequences of dyslexia in some cases are severe, and managing a student's emotional health is extremely important. And of course, prevention of failure in the first place and accurate labeling of what's going on are critical pieces of maintaining emotional health in a child who's very frustrated and wondering what in the heck's going on with them. And we want to identify early to avoid this syndrome of chronic and learned helplessness and avoidance and feelings of inadequacy. This goes back to using the D word. One reason to do it is that it's a big relief to students to have a name for the problems they are experiencing. It sounds a little bit more definite than a word level reading problem, which is what researchers often call it. So we want successful students. Even if we can't make the dyslexia go away, and it won't, it will affect students through their schooling in the main. We want to give students, while we're remediating the problem, a repertoire of effective coping strategies, study skill strategies, and reinforce independent use of those strategies as students get older. We want to encourage resilience and thinking positive about the good things that are happening, the things that are possible. We want to encourage flexibility. We want to encourage self-advocacy, being able to talk about what dyslexia is and what's going on. So information about it is very empowering for students.
Effective instruction contains all these components: explicit, systematic, cumulative, sequential, incremental, and data-driven. I'm just going to review these briefly because we're bumping up against our 1 o'clock end time. We don't want to leave anything to chance with students. We want to make sure we're clearly explaining all the concepts, especially the ones that are going to cause a lot of confusion. Our instruction is systematic, and the lessons follow familiar teacher-led routines. Having clear and consistent instructional routines allows students to focus on the new concept that's being taught and doesn't leave them wondering what the teacher wants them to do next. They're consistent, they happen over time, and it doesn't leave anything, any confusing questions in the student's mind. Cumulative, I mentioned earlier that it's very important, and good programs are going to have cumulative review built in, so that's not up to the teacher to have to figure out what should I be reviewing. The program's going to give them some guidance in that regard. And the instruction is sequential and incremental. It's following a plan, scope, and sequence, and progresses in measurable, manageable steps. And lastly, it's data-driven. Progress monitoring assessments are used frequently. Our tier 3 students that are in the need of most critical intervention, they need to be progress monitored once per week. Our tier 2 students who are more strategic, they need to be progress monitored at least once a month, but many recommend biweekly. And then our students who are at benchmark and above, those not in intervention, they need to have at least 2 or 3 times a year of benchmarking. And curriculum-based measurements that are usually part of any good intervention or tier 1 program really focus on the monitoring the progress of the learning for that particular sequence of lessons. And to conclude here, multisensory, successful instruction includes multisensory learning where children are using all their senses to learn the concepts of language. And I'm trying to go to the next slide and I'm not having success doing that. There we go, thank you. Lastly, regarding reading and writing tasks for older students, the importance of teaching cognitive strategies such as deciding what the goal of the task is, monitoring whether they're accomplishing the goal, knowing when they do and don't understand, and having an approach for tackling complex tasks is going to be important. So that concludes my portion on instruction. I'm going to turn this back over to Louisa now so that she can say some final words.
Thank you, Dale. That was a great overview of what needs to be done. So even though we have this high proportion of kids who are correctly described as having symptoms of dyslexia, as many as, let's say, between 10 and 15%, most of these students can be successful in life. And those who are successful have learned about themselves. They often have the right way of describing what is going on with them. They understand that when they have a reading problem, it's not symptomatic of generally low ability or lack of potential. These are students who can use resources to help themselves, who can connect with a mentor and role models, and who are continuing to learn as they go and maximizing their individual strengths. So it's not it's not a life sentence for low performance by any means, especially if the student is surrounded by people who understand the nature of their problem and what can be done to help out. So putting it all together, we want to emphasize how important it is to use really good screening tools to identify students as early as possible, to use explicit and systematic instruction in the regular classroom that has all of the key components of the essential components of instruction that Dale described. We want to monitor progress and intervene proactively if kids aren't progressing by changing something for the better. We want to be sure that programming for our students is comprehensive